Hello. Today we will be presenting to you the characteristics of maxillary central and lateral incisors.
First, we're going to use the universal numbering system. This system is used by most general dentists today. Tooth number 1 is the tooth furthest back on the maxillary right, and it goes towards the midline to the laterals and centrals on the maxillary right, which are 7 and 8, and the maxillary left, which are 9 and 10. Palmar notation system is used by some orthodontists, periodontists, and oral surgeons. The mouth is divided by 4 sections called quadrants. This system also uses a unique symbol to identify the teeth in each quadrant. The number runs from the midline to the last molar. So the maxillary right central is number 1, the maxillary right lateral is number 2, and it goes for the same on the maxillary left central, which is number 1, and the lateral is number 2. The numbers sit in an L-shaped symbol that is used to identify the quadrant. The L right side up is to identify the upper left quadrant, and the backwards L is to identify the upper right quadrant. The FDI numbering system assigns each quadrant a number. The maxillary right quadrant is number 1, and the maxillary left quadrant is number 2, and so on and so forth. The teeth within each quadrant are assigned 1 through 8, which the maxillary right central is number 1, like was mentioned in the Palmar notation. So we combine the quadrant number and the Palmar notation number to get the FDI number. For the maxillary right lateral, it is 1, 2, and the maxillary right central, it is 1, 1. For the maxillary left central, it is 2, 1, and for the maxillary left lateral, it is 2, 2.
Central and lateral incisors have one root. The root is conical in shape, and it comes to a blunted apex. The root on the lateral tooth is more narrow than a central, as you can see on these two pictures. These teeth have 4 developmental lobes. In the labial view, there are 3 lobes: mesial, central, and distal lobe. In the lingual view, incisors have only 1 lobe, which is known as a cingulum, and is located at the cervical third. All the teeth have a proximal contact. They are known as a contact point. The contact point is where the mesial surface of one tooth touches the distal surface of the adjacent tooth. In this case, we have the lateral, which touches the central. The mesial part of the lateral is touching the distal part of the central. Now, there is an exception for this definition, and it is with the central incisors of both arches, because the mesial contact point of the right central, it contacts with the mesial point of the left central.
We are going to be discussing height of contour, form, and function of maxillary central and lateral incisor. The height of contour for the maxillary central is going to be located at the facial and lingual surfaces on the cervical third, and they are going to measure about 0.5 millimeters. Here in the picture, we can see the height of contour labially and the height of contour lingually. The incisal edge for the maxillary central incisor is going to make up the mesial and distal incisal angles. The mesial incisal angle is going to be sharp and straight. The distal incisal angle is going to be rounder. The outline is going to taper lingually towards the cingulum, and it's going to be centered along the tooth axis. The incisal edge view is going to show up a triangular shape. Tooth shape and function from maxillary central incisor. The tooth is going to have a choval shape and is going to act just like scissors. The thin edge is going to cut and slice food. It's going to support the lips and is going to aid in speech. Maxillary lateral incisor. The height of contour is going to be located facially by the cervical third and lingually by the cervical third. It's going to measure about 0.5 millimeters. From the incisal edge view, the lateral incisor is going to be very similar to a central incisor, but it's not going to be straight on the mesial incisal angle. In this case, it's going to be rounder, and on the distal incisal angle is going to be rounder as well. It's going to show up more convexity on the labial side.
I will be summarizing and discussing about some of the key characteristics that we need to have in mind when we want to distinguish between centrals and laterals. Function for both the teeth are shearing or cutting food, speech, and support for lips. What we see from the labial view. Centrals will have a bigger crown, and it is the widest teeth mesial distally than the lateral teeth. The lateral teeth is more narrow mesial distally and is often missing or peg-shaped. A good example of a peg-shaped tooth. What we see from the lingual view. Lateral teeth are more likely to have a deeper lingual fossa and pit than the central. The lateral incisor cingulum is more developed and centered. The cingulum for the central incisor is off-centered towards the distal. What we see from the incisal view. The central teeth have a distal lingual twist of incisal edge. Maxillary centrals have a triangular crown outline, and the laterals have a more round or oval outline. The laterals will also have a more labial curvature than the central incisors. The central incisors will have a flatter facial surface. What we see from the proximal view. The largest CEJ curve for all teeth will be the mesial curve on the central incisors. However, the CEJ for all anterior teeth will curve more mesial than the distal.
Maxillary centrals calcify at 3 to 4 months. They erupt at around 7 to 8 years of age, and the roots are completed at 10 years of age. Maxillary laterals will calcify at 10 to 12 months. They will erupt at 8 to 9 years, and the roots are completed at 11 years of age.